I'm Dr. John Morton, and I'm Chief of Bariatric and Minimally Invasive Surgery at Stanford University. The Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program is absolutely instrumental to the optimal care of the bariatric surgery patient. This program, which we called MBSAQIP, was instituted a couple of years ago, working together with the American College of Surgeons and the American Society of Metabolic and Bariatric Surgery to achieve one goal, and that's to improve the health and welfare of our bariatric surgery patients. Obesity is a big problem in this country, but we do know that surgery is something that can help folks. And we do know that the best place that they can get that help is at these accredited centers. The accredited centers' benefits are many, everything from decreasing costs to decreasing readmissions to decreasing complications, also better failure to rescue rates. Those are things that we've seen at these centers. And what's the hallmark to these centers? What makes them better than other centers, or the ability to provide that care? And I think it has to do with the multidisciplinary aspect that's present at all these centers, where there's psychological and dietary support, but more importantly, keeping track of your outcomes, something that we've learned from NISQIP and something that we embody at MBSAQIP. And that is collecting all of this data, prospective data, with well thought out definitions and follow-up for these patients. Extremely important, and that's what the accreditation program provides. It provides a high degree of assurance to anyone seeking bariatric surgery. If you want to know the right place to go, you go to an MBSAQIP accredited center, and then you can be very assured of the very best outcome. Obesity is our leading public health problem in the United States, and surgery is the leading edge of treatment for these patients. We're learning that there's going to be an established continuum of care for these patients, from everything from counseling to medication to endoscopic procedures and up to surgery. And we really feel that the medical home for these patients is really going to be in an MBSAQIP accredited center where all of those different interventions can take place. I think the one thing that we can say is that obesity is a big problem that requires a lot of help, and you can get that kind of help at a MBSAQIP accredited center. And I think it's important because obesity affects so many of us in ways more than one. For example, it can affect an orthopedic surgeon that has to do a hip or knee replacement who has an obese patient. But the story that needs to go forward is there is help and there is hope available for the obese patient. And if they get that treatment, we can get them better treatment, more effective treatment with less complications. And again, best place to do that is obviously in an MBSAQIP accredited center.